Good afternoon and welcome to the Division 47 webinar entitled Consulting with Athletes with Disabilities, Building on Theory, Practice, and Reflection. Please note all participants are muted throughout the webinar. You can submit your questions using the Questions tab during the webinar. However, questions will be answered within the last 15 minutes of the presentation. And now we will have an introduction of the speakers from Marina Galante. Marina?
Thank you, Olivia, and welcome everybody. This presentation is hosted by APA Division 47, which is the Society for Sport, Exercise, and Performance Psychology. I'm Marina Galante, and I'm one of two student representatives for Division 47, along with Bree Jones. And so on behalf of the division, we'd love to welcome you all to today's event. We have three really amazing presenters today, and we'll leave approximately 15 minutes at the end of the presentation for a question and answer session. So as questions come up during the presentation, please send them in using your webinar control panel. For anyone who's unable to join us today, the webinar will be recorded and posted on the Division 47 social media pages and listserv in the coming weeks. And then finally, Division 47 will be live tweeting during the webinar. So if you're on social media during or after the event, please use the hashtag DisabilityDeafSport. Again, that's hashtag DisabilityDeafSport. We're really fortunate today to have an amazing panel of speakers agree to take part in today's event. The presenters today include Dr. Becky Clark, Dr. Jeannie Shapiro, and Dr. Artur Potsvardarski. Becky is a mental performance consultant, sports diplomat, and psychotherapist in private practice in New York City and has worked with athletes with disabilities from over 100 countries. Jamie is a professor and assistant director of the master's program in sport and performance psychology at the University of Denver. She has been a mental performance consultant with several U.S. Paralympics teams since 2014. And Artur is a professor at the University of Denver Graduate School of Professional Psychology and is a senior mental coach with Sport and Performance Excellence Consultants and U.S. Paralympics. So now I'll go ahead and hand it over to Becky.
I'm coming. Hello, everyone. Welcome to the webinar on Consulting with Athletes with Disabilities. I'm trying to get my screen up here. Here we go. I'm gonna basically what I'm gonna cover. All three of us have different sections that we're covering, so we try not to overlap. And so today I'm gonna start with the terminology, sporting events, talk about best practices for sensory disabilities, and reflective and lessons learned. So I'm going to start basically here with the definition of disability. I'm trying to, the screen's not working here, sorry. Here we go. Jeez. Here we go, disability, sorry about that. All right, disability as defined by the United Nations Convention on Rights of Persons with Disabilities in 2006. CRPD is also known as the Disability Treaty. The definition is persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. You may find people, it's not working here, here we go. The spectrum of disabilities includes those with hidden disabilities such as deafness, autism, ADHD. You have single to multiple disabilities, may have deafblind or mobility, hearing impairment, visual impairment, and you also have those of us who are born with our disabilities, which is congenital, or those who acquire the disabilities later in life. I would like to be mentioned just to come out and be transparent. I am a former deaf athlete, a deaf professional now. I'm using cochlear implants and written and type accessibility here today. So I am also a three-time deaf Olympian and former basketball player for University of Tennessee Lady Ball. So if any Lady Ball fans out there, hello. Welcome to the big dance. All right, we're moving on to the sport integration continuum. There's 5 different types of participation for disabilities, athletes with disabilities. The top spot is, well, it's not the top spot. It's number 1 and 2 are regular sport with or without accommodation. That's like mainstream sports. And then you have number 3, which is regular and adaptive sport, which tend to happen parallel at the same time. And then 4 is adaptive sport integrated, when you have athletes with disabilities who are also playing with able-bodied and more of some like swimming. There may not be any adaptations necessary for that. There may be so. And you have set rules that both able-bodied and athletes with disabilities follow. And finally, you have disability or adaptive sports segregated, which is sort of like is the Paralympics, Deaf Olympics, Special Olympics, although the specific disability sport. Moving on, terminology with disability sports, also known as parasport, adaptive sport, sport for the disabled, sport for athletes with disabilities. We use person first language rather than say, you're going to see this on the next slide. I say deaf sport because we say disability sport here for just a moment. But we tend to say the person first and then the disability rather than label the person disability first, like blind athletes or deaf athletes. The definition is one of the good definitions by DePaul and Gabon of disability sport is sport that's been designed for a specific practice by athletes with disabilities. Disability sports may include sports that were designed for a selective disability group, goalball for blind athletes, wheelchair basketball for athletes with physical impairments who use a wheelchair, or sitting volleyball for athletes with lower limb impairments. Furthermore, disability sport also includes sports practiced by able-bodied individuals and sports such as track and field, athletics, volleyball, swimming that have been modified or adapted to include athletes with disabilities. And there was a wheelchair tennis, tandem cycling, as those that would require modification, and then there are those who require, modification to allow individuals with disability to participate. Again, that's wrestling, athletics, and swimming, and so on. Okay. All right, you will find on the next slide, I'm going to identify, I'll wait back to pass, here we go. Oh, I'm going the wrong way, sorry. Yeah, that was the end of that. I'm having trouble with this over here. I'm sorry, with deaf sport, or actually I'm going to go from here. Let me see if I can pull this back up. Slide. Okay. Deaf sport, the deaf athlete is a physically able-bodied athlete and able to compete without significant restrictions, and with the exception of communication barriers. In team sports and some individual events, hearing loss can be limiting. The sport and their rules are identical to those of able-bodied athletes. There are no special sports, and only adaptations are to make auditory cues visible. For example, we use strobe lights for starting signals. Among the athletes allowed to compete in the Deaf Olympics or Deaf Games, Deaf Sport, there are no classifications, which Jamie will talk about later, classifications for physical disabilities. Nor are there any restrictions except for the requirement that each athlete must have, deaf or hard of hearing athlete must have a hearing loss of 55 decibel loss in the better ear. Some of the major events of deaf and disability sport, the reason they're split, and I'm sure you may have some question about it later, is disability sport, the Paralympics tend to have mostly physical disabilities, intellectual disabilities. There's rare any deaf athletes, but there are some with multiple disabilities in the Paralympics and other type mixed games. But for deaf sport, it's the only requirement is that you have a hearing loss. And with the Paralympics and the Deaf Olympics, they do have an MOU that said that one or the other, if you have one or the other, if you're deaf and you have a visual impairment, you can compete in the Paralympics in addition to requiring for performance performance requirements, and vice versa for the Paralympics and the Deaf Olympics. And you do have deaf and visually impaired and blind that also participate in the Special Olympics. But some of the major deaf and disability sport competitions are Deaf Olympics, Paralympics, Special Olympics, Invictus Games, Warrior Games. One of the newer sports are the Warfighter sports that was established in 2003 by Disabled Sports USA. World Championships and National Championships. Now, this may see some elite, but we are not focusing all on elite athletes. This could be any level that athletes with disabilities can compete in, from club, recreational, to college and high school, and on to pro and Olympics, Paralympics, and so on, to the elite athlete. Okay. Next one, the Paralympics. I want to say the Paralympics, the Special Olympics, and the Deaf Olympics, all three are sanctioned and recognized by the International Olympic Committee. All three of them are. But with the exception, all three of them are. In terms of the Paralympics, they're a multi-disability, multi-sport international competition for athletes with disabilities, specifically, but not limited to physical, blind, visual impairment, intellectual disabilities. It's governed by the International Paralympic Committee. You can see there's a link to the website too, if you want more information. And like this, the Deaf Olympics, Paralympics, and Special Olympics are held every 4 years, between summer and winter, that cycle every 2 years, alternating. In fact, right now, the Special Olympics have the World Games that are going on, and Deaf Olympic Winter Deaf Olympics will be later on. I believe it's in November, December in Italy this year, and then we will have National World Championship happening for the Paralympics, which Jamie and Archer can talk more about. The Deaf Olympics itself is a multi-sport organization for athletes with disabilities, specifically for deaf and hard of hearing. I've already mentioned that you must have a 55 decibel pure tone average loss and the better hearing ear. Hearing aids and cochlear implants are not permitted in competition. That's only in the Deaf Olympics. You may use them in college or at any other level, but the Deaf Olympics tries to have a fair playing field, so there are no listening devices. Okay. And deaf and hard of hearing actually do not consider themselves disabled, only that they cannot hear. Visual cues are substituted for auditory sounds. As I said, I've covered the Special Olympics. Okay, it's founded by Eunice Kennedy Shriver in '68. It's the international sport competition for athletes with disabilities. I want to move on to, I feel like we're having like a 5-slide quick presentation, because this is so much information for athletes with disabilities we're trying to cover. So I'm specifically only going to cover the sensory disabilities, deaf, hard of hearing, visually impaired, blind, and deaf blind. Okay, and Jamie and Archer will cover the physical disabilities. Okay, for the best practice for consulting for athletes who are deaf or hard of hearing, you want to find out from the athletes what their preferred communication is. Not all deaf athletes lip read. Even the best lip readers, including myself, only get a specific small percentage due to the consonants and phonemes that are not visible on the lips anyway. So I call it lip guessing. And those of us who sign, I am fluent in American Sign Language and International Sign Language. There are over 140 sign languages in the world. So you may have different spoken languages in different countries. You do have different sign languages in different countries as well. Okay. All right. Now, when you are talking, be sure to speak clearly and slowly, but not to exaggerate your lips. And make sure that there's no light or sun behind you that will blind when you're talking, that will blind the deaf athlete when you're communicating. Use visual communication skills. Make eye contact. Demonstrate your instructions and ask athletes to mirror your movements. And be aware. This is very important. Be aware that deaf and hard of hearing athletes will not be able to hear you when they are actively performing. I had a coach that I was working with first time that he had ever worked with deaf or hard of hearing athletes, and he was screaming at them while they were playing, like most coaches do, to give instructions. Well, they just kept playing and could understand why they were ignoring him. Actually, hey, coach, they can't hear you. So you need to give your instructions ahead of performance or during warm up, timeout, halftime. Okay, and working with large practices, you want to divide them in smaller groups, which helps facilitates the ease of communication. As with athletes who are blind and visually impaired, you want to talk and observe with athletes to better understand the nature of their vision loss as well as strengths and challenges. You do the same thing with those with hearing impairments as well, but focus more on what their hearing loss is or their disability is. Okay. Be sure that the communication with athletes, as opposed to deaf and hard of hearing athletes with visually impairment, they're highly descriptive, accurate, and verbal. Communications need to be highly auditorily descriptive, accurate, and verbal. And using print and electronic media, be sure to use methods that are compatible with the athlete's capabilities and resources. And also, in terms of when you're doing imagery exercises, there may have some visually impaired athletes who can see some. They may be able to use the visual information in terms of the auditory as well, both. Um, and also can use it for past memory of what they've seen or what they were able to see in the past. Fellow athletes, you want to come up with verbal communication strategies and cues that will help. And this is also the same with deaf and hard of hearing athletes in terms of vision, where you have the hearing impairment we see with visual signs, and blind and visual impairment with auditory cues. Okay, we want to also, Archer will talk about this later, about preparation for travel to new and unfamiliar facilities for practice or competition. Be prepared to help the athletes reduce anxiety associated with transition, allow for extra time, and also for increased attention to their athletic performance. Plan ahead and consulting with these athletes to make any kind of adaptation, and that also includes sensory athletes, sensory disabled athletes, including physical disabilities. Okay, we're going to move on here. Lex, I want to talk a little bit about reflective practice. Like with the professional philosophy, it's important that we all as consultants have a philosophy for our core or beliefs, and we'll be working with our clients what theories we're using, and what, including models of disabilities that Jamie will discuss in just a second, and Arthur will talk about other theories of practice. Have an assessment, action plan, interventions, and review, which I reflect back on all of my work in clinically and in performance enhancement with athletes. I have reflected on the insight and feedback that athletes, coaches, and colleagues give me that inform my own work. Mentoring athletes and students have been a big part of my career, and I enjoy it in both performance and clinical, and it's the way of giving back to the profession. And growth. We have a growth mindset as a consultant, I professionally and also with the client. Whether your client's athlete, coaches, parents, or support staff, you're probably going to be working with more than just the client, but the client is the center, is the identifying client, and is the center of your treatment, and with addition to all the other resources. And just a few of the lessons that I've learned when working with these populations with sensory disabilities and with physical disabilities, all disabilities, is that I become more and more creative in working with clients and thinking outside the box, not so much just adapting, but also in how I develop my report and communication, and being mindful of multicultural perspectives and diversity, and the power of communication in challenging situations. Mindful of boundaries, Jamie will speak about that too. And also as a consultant, be mindful of how you cope and deal with your own stress management, and the importance of self-care as a professional consultant. And for those of you like me who are in private practice, it is important that you reach out and make time with colleagues and friends because work can be very isolating. Be mindful of life, work, and balance. Thank you. We'll move on to Jamie.
Hi everyone, I'm Jamie Shapiro. As was mentioned, I'm an associate professor at the University of Denver, which is my full-time job. And I'm also a consultant with Sport and Performance Excellence Consultants in Denver, Colorado. The work with U.S. Paralympic athletes is something that has fallen into my lap, basically, and our tour's lap as well, just from being in Denver. The folks at Colorado Springs Olympic Training Center contacted us, and I really had no training with athletes with disabilities. So this is something that I've learned on the job by reading, attending conferences, of course, observing and asking questions, and just always constantly learning and growing. So what I'm going to talk about first are the different models of disabilities, and these are different philosophical and psychological perspectives on human behavior, and it's important to know these models in terms of your own, examining your own beliefs on people with disabilities, as well as conceptualizing the clients that you're working with, and also seeing how your clients are conceptualizing their own disabilities. So the first model that's out there is the medical model, which views impairment as an individual problem. It's a biological or medical issue that must be cured or fixed. The next model is the social model, which is the other extreme, saying it's really the environment that is disabling people. So things like lack of opportunity for people with disabilities, different structural barriers such as lack of ramps, different transportation barriers, and as well as people's attitudes and behaviors towards people with disabilities. The social relational model combines the medical model and social model, so I like to ascribe to this model, looking at both the medical pieces of impairments or disabilities, as well as the different environmental factors that are challenging for people with disabilities. For example, a structural barrier that I observed come into play at the Pan American Games was that the buses could only accommodate 2 to 3 wheelchairs each bus. So you can imagine how much planning and getting there early the athletes had to do, and how that played into their routine and their mental game. Another model is the tragedy model, and this is certainly not something I ascribe to, which is that the view that having an impairment is tragic and people with disabilities should be pitied. But it is important to know that that is out there, and that our clients who have disabilities might be experiencing this from others. And then finally, the affirmation model takes the opposing view that even though having a disability can be challenging, it actually may result in growth and benefits. And this relates to the literature on stress-related growth, that after a stressor, especially for people with acquired disabilities, the person might actually experience some sort of growth and meaning in their disability. I see this with athletes who are really appreciative of the opportunities they have. Say a Paralympic athlete can travel the world or compete in international competition, and this might be something that they wouldn't have experienced otherwise. I did want to give you some background on classification, because this is very important when it comes to athletes with physical disabilities, and as our tour will mention later, can actually be a source of stress for some of the athletes. So the classification system is that the athletes are placed into categories based on their impairment, and it's an attempt to make the competition fair and level the playing field for the people with different levels of disabilities. So what will happen is, at an international competition, the athlete will go into a room and be evaluated by several classifiers and be assigned some sort of classification. I'll go over the eligible impairment types in a second. And someone with a degenerative disease might have to be classified periodically. And so again, you can imagine that that could be a source of stress for people. There's also different classifications for different sports. So some sports, I'll go over the 10 eligible impairment types now, and you can learn more about classification with those links. But here are the 10 eligible impairment types, and you'll see different impaired muscle power, range of movement, maybe limb deficiency, leg length difference. Short stature, for example, is only in a few sports. It's not in, I work with alpine skiing and snowboarding. It's in neither of those sports, but I have also worked with swimming and track and field, and it is a classification in those sports. Different types of neuromuscular diseases as well. Cerebral palsy is something you see commonly in the Paralympics. And then you have visual impairment, which Becky talked quite a bit about. And then finally, intellectual impairment is only in a few sports as well, such as track and field and swimming. And that confuses people a little bit, because when you think of the difference between Paralympics and Special Olympics, the difference is often explained that Special Olympics is for people with cognitive disabilities, whereas Paralympics is for people with physical disabilities. However, there is an intellectual impairment category in the Paralympics as well, and these are people who are completely physically able and quite talented and elite athletes, but have a lower IQ. So I wanted to turn to how do we adapt some of our consulting to athletes with physical disabilities, and I would say that it's very similar, that you could do a lot of the same mental training that you would do with able-bodied athletes with disabilities. And it's important as a consultant to focus on your client's ability versus their disability. So I often try to use the language of ability level versus disability level. Something to certainly consider with group sessions is the space that you're in. For example, if you have people with wheelchairs, as well as people with prosthetics, and then people who are visually impaired who might have guide dogs with them, you have to make sure that the space accommodates that. And so you may have to change how the tables and chairs are set up. It also requires careful planning, that an activity you might do with able-bodied athletes, for instance, if you have them throw a ball around as part of an activity, you have to think, well, how would this work, or would it work with people who are missing certain limbs like arms, or people who are visually impaired? In addition, if you have a writing activity, you have to think about the visually impaired athletes, and are they able to write? Do they need assistance? Could they have a staff member help them write? Or perhaps it's better to have them audio record or type into their phone. So being accommodating for that. I wanted to just go through some examples of different mental training skills and how you might accommodate them for a specific disability. So first is goal setting, and that can essentially be done the same as with able-bodied athletes, just setting goals. I think, again, if you're having athletes write goals, be aware for visually impaired athletes of allowing them to use their phone for that. For arousal control, in terms of breath control, diaphragmatic breathing, you have to be conscious of individuals who might not be able to use their abdominal muscles. So I know I often teach diaphragmatic breathing, but it's important to ask the athletes, are you able to use your abdominal muscles or not, and then tailor the breathing approach to what works for them. Same with relaxation. So if you're doing progressive muscle relaxation where you're having them tense and relax the muscles, you want to be aware of a few different things. First, for individuals with, say, cerebral palsy, tensing certain muscles can cause spasticity. So you have to be aware of that, and maybe more passive relaxation exercises where they're not tensing could be more appropriate for them. But you want to ask, again, how does this work for you? And then people who either don't have feeling or have paralysis in certain limbs or are missing certain limbs, you want to be careful of telling them to, say, tense an arm when they may not have feeling in that arm. So that's been a challenge for me with group sessions, and something that I've incorporated into the scripts has been to say, tense your right arm if you are able. And I say that with every body part. But again, asking individuals, how was that experience? what would you prefer in terms of different relaxation techniques would be really important there, and tailoring it to them. For attention and concentration, just making sure that the cues are appropriate to the type of disability as well as the type of sport. Cues become really important with guides for visually impaired. So for example, in skiing, the visually impaired athlete is skiing behind their guide and communicating via audio headset. So you want to make sure that they understand the cues to focus on. They're usually focusing on their guide in front of them as well as the auditory cues. So helping develop that is really important. For imagery, something to be aware of is focusing on controllability, especially for athletes who may have acquired a disability. They may imagine themselves pre-disability, and that may frustrate them, or cause some other negative emotions. So working with them on being able to control their imagery and really see it realistically with the equipment they're using and their current ability functioning would be really important. As well as visually impaired athletes can do imagery. So some of them may have been able to see before their injury, or some can see something. They could see shapes or colors. And so it's important for you to ask, what can you see, and incorporate that into the script for them as well. I once met a practitioner who said they didn't do imagery with visually impaired because they thought they couldn't do it, but they can, and the athlete expressed that to them. And of course, incorporating the other senses, especially the kinesthetic sense or sense of body awareness, would be extremely important for any athlete, including a visually impaired athlete. For confidence, here's where that affirmation model of disability could be useful. So thinking of things they're grateful for, focusing on their strengths, focusing on past good performances, things like that to help build their confidence. And finally, routines is something I focus a lot on with athletes, both routines before competition, during competition, and after. So that mental preparation piece and the routines become very important. Becky mentioned being prepared for transportation, the equipment. For instance, an athlete had to ask us to carry their walking leg up to the finish line. So being helpful to athletes for that, just knowing where the bathrooms are and when they could go to the bathroom. We learned a little too much information about how important the bathroom is for pre-competition routines, but helping athletes refine that depending on their venue. And then their during competition routines, keywords are very important to stay task focused. And then I like to focus on reflection with performers after their competition. So what went well and what's worth improving, and making sure that they're being reflective performers. I'm going to move on to some personal examples of how I practice. So I wanted to quickly introduce my theoretical orientation of performance excellence, which I've called Mind Your Mental Energy. As you can see from the picture on the right, I view motivation, relationships, and physical knowledge, skills, and abilities as kind of the roots to having a productive mindset. And I use the word productive versus positive because sometimes athletes are not going to have a positive mindset. Maybe they're not having a good day. They didn't perform the way that they wanted to. So I like to use the word productive and unproductive because, a mindset could be more neutral, or sometimes athletes actually find that negative statements can help and motivate them. So you want to find out, is this useful, productive, or helpful for you? And then find out where their mental energy is. And if it's not productive, switch or reframe it to something more productive. And this, of course, comes mostly from the cognitive behavioral theory. I also incorporate person-centered theory into my work as well. So I want to make sure their mental preparation is productive, that they have a present moment focus during performance, that their mind is where it needs to be when it needs to be there, and that their evaluation or reflection is productive after performance. And I work a lot with people to focus on what's under their control. To give some examples of this theory in action, one would be at the Pan American Games in Toronto, when a coach referred an athlete to me who's quite nervous, had never performed in this type of games before, and I didn't know her, so I had to, build trust very quickly and build that rapport really quickly But I really worked with her on creating very task-focused cues and routines, again, before, during, and after performance. And I was lucky that I was able to see her actually a couple of months later at a camp, and she told me, well, that was really helpful. And it was nice to receive feedback because we don't always receive that feedback. Another example at the Paralympic Games was when an athlete told me, I don't know what to do. So she was behind in the qualifying rounds, wasn't sure she'd make the final. She had never been in that position before. She was expected to medal and was in panic mode. And so she says, I don't know what to do. So you can imagine an elite athlete telling you that. And so I refocused her on reminders. Okay, tell me why you do know what to do. And we went through an imagery script a couple of times with her cues for the course to help build that confidence that if she stays task focused, she'll know what to do. And luckily it worked out and she ended up getting a medal. Something I think that's common for the athletes we work with is that this is not their full-time job. So some of them are training full-time, but most of them are doing other things. We have quite a few college students who are Paralympic athletes. Other athletes have to work to, make a living. And so they can get really overwhelmed with all their obligations, especially when coaches and staff really view them as full-time athletes, and yet they may not be full-time athletes. So helping them prioritize and stick to that and focus on what's in their control is something really important. Some reflections, again, I stole this from our tour, the WWW and WWI, what went well and what's worth improving. We ask athletes to do that. So I thought I would do that as well in terms of our work. So I think probably because Paralympic athletes may not receive the same level of resources as able-bodied athletes, we found that they've really been appreciative of our work with them, and we built rapport really quickly, and they've been excited for mental training. So they just want more and more. And luckily, the U.S. Paralympics hired Dr. Sarah Mitchell, who's on the left in that picture, and she's the first full-time sports psychologist for Paralympics. She now helps coordinate our services. And so that's been an amazing development in terms of our services because we're part-time contractors. And that's been really helpful to see that develop. It was nice also to see in Pyeongchang that the athletes finally knew how to use us. We'd been working with them for almost 4 years, and it was really seamless. They knew to check in with us before and after their runs, in the village, at night if they wanted to. So that was really rewarding. In terms of what could still be improved, I think I'm always trying to work on that creativity with adapting activities. Certainly personally as a performer, as a consultant, is dealing with uncomfortable living conditions, such as having roommates and being in dorms, making sure I'm maintaining boundaries when you're with these clients, whether it's coaches or athletes, from the morning until night, making sure you're maintaining those boundaries and still being a human. So of course you're going to have some personal conversations, but still making sure it's professional and you're not crossing boundaries too much. Energy management is something I'm consistently trying to work on. Again, you're kind of on from the morning until night with very little breaks. So that's something always to be working on. Consistency in contact with the athletes. So we see them at training camps and competitions and try to Skype in between. But for instance, with one team this year, we've only seen them a couple times in person for the whole season. And that could be really challenging. And so always trying to work on how do we stay in contact consistently to make our consulting more effective is something we're constantly working on. And then finally, having some closure and consolidation with athletes post games. The ones that retired, we may not see again. To close, just some lessons learned. Mental training is more similar than different with adaptive athletes, but still be an adaptive mental performance consultant or sports psychologist. Be aware of environmental stressors that affect para-athletes' mental game. Be okay with not being needed all the time. So sometimes at the games, I was like, what am I doing? Am I actually doing something here? And then other times be like, oh, can I talk to you really quickly? So make sure you're ready for that. And finally, as Becky mentioned, having some sort of support. We are so lucky to have Sarah, Artur, and myself as a mental performance team to collaborate, support each other, and make sure we're doing okay. I have some pictures there of Artur and I having some fun at the opening and closing ceremonies. And then that's me doing a handstand, just a good symbol of balance, and trying to also soak up the experience, just like our athletes. So now I will hand it over to Artur to talk about some of the research with Paralympic athletes, as well as his own theory, philosophy, and practice.
Hello, everyone. I appreciate being part of this webinar. Thank you, Division47, and thanks everyone for tuning in. This is such an important and exhilarating part of the sports world, so I appreciate being able to share my experiences in this wonderful community of learners. So Jamie already mentioned how we got involved in Paralympic movement, being in Denver. Also, we share work in the department and also as private consultants in our private business. So my work with Paralympians started four years ago in the late 2014, and my primary experiences will be continuing the thread that's Jamie started: physical disabilities and also elite level of performance, working with alpine skiing, para-Nordic skiing, para-snowboarding, and in the past also a wonderful experience with para-swimming. As already mentioned, Jamie mentioned, we came to this area quite new, quite fresh, and it was so comforting for me to learn that from other colleagues and professionals who worked with athletes with disabilities, that primarily the athletes with physical disabilities share similarities to able-bodied athletes in how they approach preparation and competition. Also reading in the literature, if you take a note of the title that Kristen Diefenbach and Tracy Stadler put in their paper in 2012, it says more similar than different, the psychological environment of Paralympic sport. So there is a number of differences, that similarities that were documented in the literature, and then Diefenbach and Stadler reviewed some of those, and the literature is abundant with original research and reports from studies and experimentation. So the similarities deal with the reasons for participation in physical activity or in adaptive sports, but also mental approaches and psychological skills that are necessary for elite competition. Mood states and then motivation, not significant differences between able-bodied athletes and athletes with disabilities. One of the original research that I read was from Dr. Henshen, my mentor from University of Utah, when I was still back in Poland as a young professional trying to get into a doctoral program, and his publications in the early 90s were an eye-opener for me, first of all, to conduct applied research, and second, to the mindset of athletes with disabilities. Also, similarities were reported in terms of self-esteem and levels of athletic identity. These similarities notwithstanding, athletes with physical disabilities have different needs in those contexts, in practice contexts, and also competitive environments. I wanted to raise everyone's awareness and point them to a special issue that in the Psychology of Sport and Exercise journal last year, that beautifully and so thoroughly outlines the landscape of research and understanding the sport, disabled sport. Two articles that come to mind and I put immediately to use was McDonald's and colleagues' report on mindfulness training with wheel basketball athletes, and they were reporting how this 6-week, 45-minute per week mindfulness training is helping athletes to cope with stress, improve their concentration, and also spills over in a positive way to other areas of their life and functioning, for example, sleep. Another paper that I took a note of was by Bandon and colleagues, and they were examining narratives of individuals at the end of their careers in parasports. They were identifying specific barriers and the specific opportunities that those athletes face during that transition time. So let me, in the remainder of this part of my presentation, focus on those unique considerations to work with Paralympics. Jamie have already mentioned the frustrations and stress that circles around classifications. So athletes are quite often frustrated with how they were classified themselves and how other athletes unfairly in their perception was classified, so they have an advantage over them. The classification is meant to level the field, so to speak, and make the competition fair. So that's very important consideration for athletes, and that's a recycled and renewed topic in my conversations and consultations with my clients. So what I noticed and early started leaning into cognitive behavioral approaches in which we decided to reason with those unfair classifications. We want to apply the logic and perhaps stop those negative emotions and switch to thoughts and switch to a positive mindset. And we developed a number of different strategies that would be allowing the athlete to let it go, not thinking about it, replacing with something more constructive, or utilizing Jamie's language, something more productive. But those thoughts were lingering, and I didn't receive any much traction with the athletes, and they always, especially on the days prior to the competitions or races, or the day of it, they experienced those frustrations. And as I was consulting with different teams, I was exposed to motivation, mindfulness, acceptance, and commitment approaches, and I started to borrow from that framework. And with my colleague, Dr. Oyagi from University of Denver, he equipped me with this metaphor, this idea of letting it be, in terms of not fusing with the emotion, with the content, and basically maintaining, having distance from it, and then refocusing on what matters in this very moment. So this let it be metaphor received a great deal of attraction with the athletes, and they actually started to report that it's working quite well. That obviously is spread out over a longer period of time. Mental training, when the diffusion from thoughts, when the mindfulness and meditation practice is needed, and then now the athletes have an option between the letting it go and between letting it be. Obviously, packaging with the metaphors, with something with the cultural memes, help the athletes to stick with that in their performances. Another very important consideration involved the social cultural context, and already as mentioned, and I'll still speak about it a little bit, is the facilities, but also importantly the societal attitudes towards disabled sport. And Jamie talked about the model, the tragedy model, and that's typically how Paralympians and athletes with disabilities are being perceived in that I observed in the conversations with my friends, with family members. So I'm taking this stance of advocacy and being an ambassador of those sports, and speak it from a different perspective of the life journey, human condition, and abilities rather than disabilities that has already been mentioned. Another piece here is the funding and resources, and typically able-bodied athletes continue to have more resources of many kinds than athletes with disabilities. However, a few years back, USOC in the United States made this financial commitment, hence the providers, Jamie, myself, and a few others, and most recently, Jamie mentioned that Sarah Mitchell, who is a senior sports psychologist at USOC, and she's fully employed there. Within this social cultural context, with all those different challenges and barriers, there is this extra layer of coping. So when we prepare for competing, almost there is an equal split in terms of negotiating the challenges, stressors, and opportunities involved in competition and racing, and equally how to deal with frustrations and all those issues and problems that athletes with disabilities encounter every single day. A couple of other examples: the need to assist, guide, and then visually impaired athlete skier. I term it as a sensorimotor translation. So guides quite often utilize verbiage, quite descriptive, but quite often they could be speaking and using visual terms and visual metaphors that would be inaccessible to the skier, the athlete. So then we assisted, Jamie and I, we were a number of times invited to assist to develop verbiage, verbal cues that are more translations of what's visual into what's kinesthetic, the muscle awareness, the movement awareness. So then the skier is able to develop their own mental image of what the races look like and what they're going to do on certain turns and segments of their course. It looks that frequency of clinical issues could be somewhat increased with athlete disabilities, especially among those who acquired the disability, and that's about 85% of athletes that reported in the literature. So here, obviously, the adequate competencies and support from clinical sports psychology staff needs to be secured, and both Jamie and I, we have privilege to have those resources at USOC. Functional deterioration with some conditions like multiple sclerosis, the adjustment needs in terms of action plans or goal setting. Working with one athlete, we had to manage this person's expectations, for example, with strength and conditioning testing, also thinking about ranking and medaling. And then I observed that we gradually were shifting more into process focus and then driving satisfaction and personal fulfillment as primary goals over performance outcomes. Physical pain that is related to prosthetics and them fitting or not fitting, bruises, inflammations. So all those everyday life pains and aches of the athletes with physical disabilities. And also in the literature, I found that there are increased reports of sport-related muscle pain. So consequently, in my own practice, I'm emphasizing and enhancing their activities that are meant to recover and then self-care as well. Some other unique considerations in winter sports for athletes: staying warm, sometimes single digits in Fahrenheit, -15, 18 Celsius. So dressing involving layers, multiple layers, and it takes time with prosthetics, with disfigured palms. So that really is quite a process for everyone. Skin exposure when they are going from their walking legs to the sit ski with the negative temperatures, they need to do it fast. We, like already mentioned by Jamie and Becky, we need to assist and are called to assist in a number of those processes and procedures. In biathlon, how gloves fit. Some athletes have finger deformation, so it's especially pulling the trigger and then handling the weapon, the rifle is much more difficult. Equipment, legs that we carry for them, poles in skiing, all of these elements could be sources of major frustrations. But it's not only in the winter sports. Going to the bathroom, a major issue, Jamie already mentioned it. Building facilities, how they're accessible in terms of doors, narrow doors, lifts, stairs, door thresholds, all those things need careful planning, and then obviously from a mental game perspective, ability to cope with those issues. Locomotions, distances that athletes need to travel on a wheelchair, or some cerebral palsy clients use crutches, so then also that's tiring process. So basically, we need to plan extra time and 2 exclamation marks for everything, from starting the morning routine and the breakfast, to getting on the bus, getting to the venue, on the venue, dressing. All of those activities take much more time. Coaches' transitions from able-bodied side required learning trajectory, and also ours required additional care, reflection, readings, asking questions, and being around. So in my practice, philosophically and theoretically, I'm grounded in a number of theoretical elements. So one of them is, for me, cognitive behavioral therapy. You did see that already. Also systems theory, the multicultural perspective, and most recently mindfulness, acceptance, and commitment approaches also shape my approach. In terms of performance excellence theory, what sits in the center of it is automaticity in human movement and also focus. All of that is nested in deep personal and professional values for my clients: dignity, freedom, autonomy, their goodness, and obviously their privacy and equality. I am an evidence-based practitioner trying to locate research that is population-specific, sport-specific, and that in addition informs my own practice. Borrow from 2 disability models that Jamie reviewed: social relational model and then affirmation model. Professional practice experience adds to my applied work, as well as collegial consultations and support. You will again see Sarah Mitchell, Jamie Shapiro, and myself. This is one of the most invigorating aspects of this work. Naturally, feedback from athletes, feedback from coaches, they add to how we go about our work with our clients. The reflective approach is so vital, and everyone already on the panel mentioned that. And especially in the Gibbs model that was brought to our field by Anderson, Knowles, and Gilborn in 2004, I'm emphasizing in this cyclical process the idea of analysis. So trying to understand what happened, what did not happen, how our actions or lack of certain techniques impacted the consultation, and also deriving the lessons, the WWW, what went well, what's worth improving, WWI, Jamie mentioned that. So in this collegial consultation, especially the analysis piece, which is down at the bottom, and also in the left upper corner action plan, it's so vitally enhanced by collaborating with someone else. Managing self as an instrument of intervention, our own fatigue level, frustrations, our expectations, all of that needs to be managed as well. So with big lessons, I was directed in those few years, and then I am now thriving on modifications, adaptations, variations, and alterations in our approaches, but they need to be purposeful, inclusive, and autonomy supportive. Obviously, communication is vital for gaining entry and also maintaining the working alliance. Other lessons, important lessons for me, was maintaining growth mindset, being patient, flexible, and creativity. Also developing appreciation for and affirmation of the abilities currently used by our clients, and in general, emphasis on the human conditions that connects us all. So all those lessons contributed to my own humility and my own sense of privilege in my professional work and being so lucky, which I extend to my everyday life. And I think that those two last quotes that I have for us summarize quite well Becky's, Jamie's, and my lessons and then philosophy. People with disabilities, like all other people, vary tremendously in their self-esteem, quality of life, the day-to-day affect they experience, how well they get along with other people, how productive they are at work, and a host of other indices that make up a person's day and in being human. And Peter Harbel put it this way: every Paralympic athlete is in certain respect like all other athletes, like some other athletes, like no other athlete. Thank you very much. And now we open to questions.
Thank you so much, panelists. That was really fantastic, and I love that you all touched on research and practice so that it would be applicable to a wide variety of audiences, and that last quote was super powerful. So now we'll open it up to some question and answers. Just a couple quick questions here for all of you guys. So you all mentioned examining our own assumptions as practitioners and touched on that. And so I was just hoping to expand more into that and ask, how can practitioners continue to do their own self-reflection when working with athletes on the ability spectrum?
I can start. I think it's important to think of a reflection model that works for you. So Artur presented the Gibbs model. I presented a simple model of just what went well, what's worth improving. And I think incorporating the multicultural and diversity piece into that of how was I working with athletes today? How am I viewing their disability? Did I incorporate it at all? I find a lot of times I don't ask about their disability. I wait for them to bring it up, which may or may not be the right way to go. I'm kind of feeling that out still. So examining how much you're incorporating a disability, which model you're ascribing to, and using that reflection model to constantly improve your work.
I might quickly add that making part of this process public, so in the sense of collaboration with your colleague, public in a sense of presenting in a seminar like today for Becky and Jamie and I connecting before that, public in a sense of collegial supervision or formal supervision that enhances this piece of self-reflection. Dr. Anderson puts this nice metaphor of reflection as is looking at the mirror, and not all mirrors are crystal clear, especially in our own mind. So we do tend to have blind spots, and then inviting someone else into that process is so extremely important and so beneficial, which I wanted to thank Jamie particularly and Sarah Mitchell here.
Wonderful. Thank you for that. And so this is another question for everybody. So you all talked a little bit about how athletes with disabilities might have different resources than able-bodied athletes, and that there is a really big need for sports psychology services. And so how might those wanting to consult with athletes across the ability spectrum seek out those opportunities?
Well, I can start here for myself. I'm, already embedded as a deaf athlete, and I would suggest that or recommend for everyone, if you start with their local um, group, clubs and high schools, that you reach out and let them know that you offer mental skills and consulting for those of us who do mental health or clinical issues with athletes with disabilities. The Paralympics and Deaflympics, all of these different levels, especially colleges, are in need of sports psychology. And then for yourself, you can advertise, marketing yourself and working with physical and sensory disabilities or athletes with disabilities, like through the ASK website or your own website. Jamie and Archer, you want to add to that?
I completely agree. I think there are adaptive organizations that you could start with. So our experience is with elite athletes, but there's a lot of developmental athletes or youth athlete organizations that I would recommend contacting and see if you can get involved in observing or coaching or mental training.
Wonderful. Well, thank you all so much for tuning in. That concludes our question and answer session for today. And then a special thank you to Artur, Becky, and Jamie for sharing your expertise with us and contributing to this webinar. I know a lot of work went into planning this. So we're very grateful for you all sharing your knowledge with us. And so just a reminder for the viewership, this webinar was recorded and will be available for viewing online in just a few weeks. And please tune in with us again this summer for a future webinar on interventions in performance psychology. And also, please stay tuned for a new initiative we have in Division 47 about Join Week, which is an event in which students can obtain a membership for Division 47 at a discounted rate. And then lastly, I'd really like to encourage anybody in today's audience to please attend this year's APA convention in Chicago from August 8th to 11th, where we have several days of really exciting programming from Division 47, a lot of which is student and early career professional oriented. All right, guys, thank you again for tuning in and have a great one.